result of which mostly these are used in combination with other materials because they produce a lot of the bone tissue debrases after performing their normal work, as a result of which are not much of that conducive for using in case of orthopedic purposes also. As a result of which, considering all these pros and cons of different implants, either it may be ceramics or it may be biomaterials or it may be whatever may be, but none of these biomaterials, none of these implants are foolproof, and different orthopedicians, material scientists, veterinarians are in search of fabricating a novel biomaterial so that ultimately after working or after discharging its functionality, it remains non-toxic to the individual also, so that it does not produce any sort of harmful effect to the host tissue. And in search of these porous bioimplants for the osteosynthesis are targeted area. Next is biodegradable and bioabsorbable implants for the osteosynthesis. These implants or bioabsorbable implants, once it is used, in course of time it will be completely absorbed within the tissue, as a result of which it need not remove it. For that purpose, you need not go for second operation for removal of the metallic or other implants which are nowadays being used. And third is of course smart biomaterial. So of course this is the age of the smartness. Now everywhere you will find smart cities, smart this thing, smart technology. Why not in the orthopedics also search some sort of smart biomaterial which after targeting its work, you forget about its functionality, it will remain within the system. And in not only that, depending on its composition as well as its external stimuli also, it will behave in that way so that it mimics the normal function of the tissue, whether it is a soft tissue or it may be even the hard tissue. Then is additive manufacturing device. In addition to this, some materials which has been used for the fabrication of this implant, some additive materials can be also used. For example, different ionic materials which can be doped within this implant so that it helps or enhance the osteosynthesis in proper way. Next is incorporating the growth factor for the osteosynthesis. Different types of growth factors are there which have the proven data of benefits for using the orthopedic purpose, and different growth factors having different site of action, different target area of action also. As per necessity, these implants can be incorporated or added or doped with these growth factors also. And then of course finally it needs a cell-based osteosynthesis also. Now let's come to the porous bioimplants. This enhances the osteointegration. Once it is used, slowly and as the time passes, it becomes the part of the host. It need not be removed without doing any sorts of harm to the tissue. As a result, it is very beneficial. If the properties or individuals or if any implants having the osteointegration property, that means once you use, you forget about its removal. In course of time, it will get absorbed in the systems without doing any sorts of problem. Because most of the time, the implants, specifically metallic implants nowadays, whatever being used, made with the titanium, made with the any sorts of stainless steel or other this thing, after a certain period of time, even though it is a companies used to claim it is a very non-corrosive, it is a non-toxic, it is a very useful, even then after a certain period of time it needs to be removed, otherwise there may be in some individual to some extent it's inside some sorts of reactions. But this material, porous biomaterial, that can be used for this purpose also. These biodegradable bioimplants are there, which are generally degraded and be absorbed by the body over a time as the fracture heals, and eliminates the need for the second surgery to remove the implants once healing is complete, and reducing the patient discomfort and health care. And like this, there are so many advantages there. Right now, that commercially one company has come up, which is of course in the women orthopedic surgery, this immune CPS. They are using these biodegradable implants in human practice. Of course, these are only using the flat bone, the non-weight bearing bone. These are not being the axial bones. but the our is less requirement is in the axial bone or the bone which is generally used for the weight bearing. From that point of view, these types of bioimplants which are being used for the maxillofacial surgery or some sort of skull surgery having the non-weight bearing structures, this is not that much of being useful in case of veterinary practice. So veterinarians are in search how to improvise this idea so that they can be utilized in case of orthopedic surgery for osteosynthesis, where this weight bearing bone are being affected to repair those complications. The smart biomaterials or smart bioimplants. What are the smart? Because smarter means the bioimplants are fabricated in such a way, but by means of genetic engineering, the implants are composed in such a way, some sorts of material is incorporated within the implants, and each shape, generally it behaves in a different way depending on the external stimuli. External stimuli means how it's piezoelectric materials, magnetic biostimuli, shape memory materials, even in the pH also. Different individuals may have different external stimuli. These implants, whenever it is being placed in that environment, ultimately it behaves as per the requirement of the host tissue. That is, same implants, it can be reacted in the different way depending on the stimuli of the individual host tissue and as per the locality. This is the advantage. So, the many scientists, many orthopedicians and material scientists of different laboratories, they are trying to fabricate such type of smart biomaterial which can be used for the future orthopedic purpose, even in the veterinary practice also. In addition to this, some additive manufacturing devices or 3D printing bioimplants are also in use, which is coming, and in different laboratories they are in the pipelines how it can be utilized for the orthopedic purpose. And as a result of which, generally what happens, by CT MRI, this first is image acquisition is taken place, and then is image pre-positioned by using the different softwares. So there's CAD, CIDCOM software is transferred into the 3D models to standard triangular language, and ultimately results to 3D printing by layer of the images. And once it is 3D printing is done, then ultimately that in these implants, as per the cellular additives, materials can be incorporated. Either it may be the growth factors, it may be the ionic materials, which can be doped so that the stimuli creates the stimuli for the further enhanced activity of osteosynthesis. As I have already told, right now the commercially some resorbable bioimplants are there which are being used in the flat bones or non-wide bearing bones. And in the different laboratories, even in the India also, many people are working how to fabricate a resorbable implants. In continuation to that idea, this entire work was done in our laboratory, where we have fabricated. This fabrication was carried out using the DLP 3D printers, and basically implants were composed of the lactide, epoxy dialyzed acrylates, and photocurable resins with seed and without seed. And we have seen that this material, whatever we have prepared, it was used, and after study for 6 months, the sum of the material was completely resolved. Of course, our duration of the study was only for the 6 months. Within the 6 months, we have found that to a greater extent the materials was absorbed and complete osteosynthesis taken place. Animal was completely mobilized even after the using in the long bone like tibia fibula in the goat. Of course, this needs a lot of work in future also, so that ultimately it can have a very better result for the even veterinary field also. In addition to this, some sorts of stem cell and growth factor also can be incorporated there. Then the different growth factors are there, starting from platelet derived growth factor, transforming growth factor, vascular endothelial growth factor, fibroelastic growth factor, epithelial cell growth factor, insulin-like growth factor, and so. So many others are coming up also, which list also can be increased in coming days. And as a result of which, this growth factor can be also incorporated within this artificially or within this 3D printed implants to be used in the osteosynthesis. In addition to this, some another ionic materials also can be incorporated. These ions like cobalt, copper, chromium, nickel. So many papers are there which has been doped within this material, which enhance the osteosynthesis activity in laboratory animal, even in the veterinary animals also. And at the end, I conclude by saying that the evolution of the implant technology has tremendous transformation from conventional bioinert materials to biomimetic substance. In orthopedics, promising the improved patient's outcome and a higher degree of the adaptability and flexibility to individual needs. The designing biocompatible, biodegradable, bioactive, smart implants with the help of the 3D printing technology opens a new avenue for creating the customized implants and response to the physiological changes in the external and internal stimulus to improve the bone remodeling. Incorporating the stem cells, different types of growth factors has shown the measured potential in the overcoming the challenges associated with the conventional implants, especially in case of the osteomyelitis, osteoporosis, and malignant bone disorders. Research efforts should aim to enhance the biocompatibility and longevity of the bioactive implants, ensuring the effective over-extended period with less side effect and achieve the biological fracture fixation in shortest possible time. And finally, the collaborative efforts within the interdisciplinary teams comprising the orthopedic surgeons, material scientists, engineers, and clinicians will help in bridging the gap between the technological innovation and practical clinical applications. These are, of course, the strategies in coming future days where these veterinary orthopedicians, human orthopedician needs to work together so that a smart, reabsorbable, very effective materials can be utilized for osteosynthesis in case of human orthopedics as well as the veterinary orthopedics also. Thank you. We have some references.
Dr. Devaki Ghosh has given a comprehensive information pertinent to the various forms of reconstructive surgery in orthopedics. As all of us know, there are many modes of treating the fractures, but we end up with the healing of the fracture but not using the affected part or the affected limb. So now the view or the objective should be such a way, apart from gaining the complete healing of the bone, how far or how best the part that is affected will come back to the originally the criteria. In that direction, he has given a very good information of using various modules which will help in the osteosynthesis and also the regaining the original biomechanics of the part also. Thank you, Dr. Devaki Ghosh, for your presentation.
Thank you, Dr. Patience.
Thank you, sir. Thank you for your this enlightening topic. So now I request again Balachandra sir, if you could do all of this again, President of October Momento, Department sir. Please, sir. Thank you so much, sir.
So next I invite the next lead paper presenter, Dr. J. Krishna Das, and his lead paper title is Common Corneal Affections in Dogs, Their Care and Treatment. Is it there?
Those who are interested in presenting their posters, they are requested to be there in the outside auditorium room. Actually there will be not limited number of that. So you are requested to be present at earliest so that you will not be missed out. Thank you.
Esteemed Chairman of the session, respected Co-Chairman, Rapporteur, and all the esteemed delegates, invitees, students, and the assistant personnel. So my topic regarding the common corneal affections in dogs and their therapeutic management. So cornea, we know, so that is the first transparent membrane of the eye, and the eye is one of the most important sensory organ by which I see you and you see me, and also by which, so all the creatures of the world, they used to see, the living creatures, they used to see of themselves and also to the environment. And cornea being the first transparent membrane, so having less than 0.7 mm thickness, so having the 5 layers, the superficial layer, the Bowman's membrane, the stroma, endothelial layer, and the Descemet's membrane. The first, the upper one, that is the superficial layer. So many times that used to be affected by various factors. So this cornea, so being the avascular and the neutral, so it is being nourished by the tear. So tear is being secreted by 3 types of glands, so located on the eye, and there occurs one film, so over the cornea. That means that is a covering, a thin covering over the cornea. So that keeps the eye and particularly the cornea nourished, moist, and also keeps it free from the outward invasion, and so also it protects. So that is called the preocular tear film. So this is the structure of the eye. So by which, so I can show. So this is the cornea. So that is nothing but the outer layer, that is the sclera, which is being modified to the transparent layer. So different types of affections used to be occur. So one of the most important affection, that is the keratitis. So that is the inflammation of the cornea. So different etiological factors are there. So out of these etiological factors, so that is the trauma of various natures. Trauma of various natures. So different types of etiological factors, the trauma, the allergy, the deficiency diseases like vitamin A, D, and so also the toxemia, diabetes, the parasites, UV light, thermal injury. So these are the different types of the etiological factors by which the cornea gets affected. The symptoms by which we will be able to know that how the cornea is being affected. So normally the cornea is a normal, transparent, and also very clear and moist, glistening appearance. So onychitis is a very painful condition by which the animal used to get the pain. And sometimes, so whenever it is being affected, so the blood vessels on the conjunctiva that used to migrate towards the cornea, so giving the peculiar appearance that is just like the root of a tree, so has been propagated to the cornea, so having the red coloration. So these are the different and the symptoms by which we used to diagnose that the cornea has been affected. So by the seeing from the naked eye, and so also by the magnifying lens, and so also by examining under the slit lamp examination. Then so we can go for the different types of the laboratory examination, and so also by aid of different instruments, optical instruments. So regarding the classification of keratitis, so it is superficial keratitis, interstitial keratitis, vascular keratitis, ulcerative keratitis, suppurative keratitis, and so also the non-suppurative keratitis. So some of the figures, because we have established one sophisticated ophthalmology unit, so at our department, so out of archive I found, so number of cases used to be presented and so also getting the treatment. So the figure so is showing the eye, so it is the superficial keratitis, only the superficial layer has been affected. So this is the interstitial keratitis by which the different layers are being affected. So this is the vascular keratitis, as I was telling, just like the roots of a tree has been propagated or migrated towards this transparent membrane. This is called another example. So that is of the vascular keratitis, is how the blood vessels from this conjunctiva and so also from the limbus, they used to migrate towards this transparent, moist and glistening appearance of the cornea. This is the suppurative keratitis. The pus used to get deposited on the cornea. This is one of the ulcerative keratitis. How the cornea get affected with the ulceration. So this ulceration may be with the superficial layer or the superficial and the Bowman's membrane, and also it used to get affected to all the layers. So having or getting injury to the cornea, full length of the injury to the cornea. So regarding the treatment, therapeutic procedure, different types of the therapeutic procedures are being adopted. So initially we used to apply the different types of the antibiotics as per culture and sensitivity test, or taking the swab from the cornea. So first of all, removal of the cause. So first of all, we have to identify what is the cause by which so the cornea get affected. So accordingly, we have to go. So the adequate, because the vitamin A, D are very essential for the health of the cornea. So that's why adequate use of oral or the parenteral therapy regarding the vitamins, and so also the topical, the antibiotics and the anti-inflammatory, different types of the antibiotic eye drops are used, and also the anti-inflammatory drops are being available. The instilling emollients like cod liver oil, milk, the sterilized milk can be applied. The milk which is being available in the packet system, so that can, because that is a sterilized and homogenized milk, so that can also be applied on the affected cornea. The hydrocortisone eye ointment can be applied, and so also the hydrocortisone injection, so given intramucosally or the subconjunctivally, so can be used. The placental extract gives a very good result. This placental extract is available, so that can be injected, and so also the placental extract So ointment are also available that can be applied topically. The milk injections, so also, so which I was telling that can be instilled or can be applied topically, and so also it can be injected subconjunctivally. So regarding the corneal ulcer, that is called the ulcerative keratitis. So this ulcerative keratitis is frequently met within the animals because the animals, the eye is being exposed, and sometimes they used to. So whenever there occurs any itching or any itching sensation, they used to scratch it on the ground, on the wall, or on the pillars or the trees. So by which, and also on the fences. So by which they used to get injury. So the trauma, the infections, different types of the infection, particularly in the post distemper condition, the nutritional deficiency, particularly the riboflavin, and the preocular tear film whenever it is being affected, and so also the keratoconjunctivitis and the progressive ulcerative keratitis. So different the symptoms as like before, the ulcers on the cornea, so easily being recognized by naked eye, by the magnifying lens, so under the microscope, optical microscope, and so also under the slit lamp examination. So if necessary, 2% fluorescein, that is a dye which is being used over the cornea to recognize. So regarding the affection, whether it is the superficial layer or the superficial and the bowmans or the stroma, or the full length of the cornea has been affected, that can be used. So can be identified, recognized by the application of the fluorescein. Fluorescein is available as a solution and so also by the strips. So whenever the ulcer heals, localized opacity of the cornea results, so because of the scar tissue. So this is the example of this the ulcerative keratitis. Then complications used to be observed in case of this ulcerative keratitis, that is one such that is called the keratocele. So in this keratocele, so there occurs the protrusion of Descemet's membrane. Descemet's membrane, that is the last membrane of the innermost membrane. The last part innermost membrane. So below that, there is another layer, that is the endothelial layer, very thin layer. So this, whenever the superficial bowmans and the stroma get injured, so by which this Descemet's membrane used to be projected or used to be protruded out. So that is called the descemetocele or the keratocele. So this sometimes this keratocele may rupture because whenever there was ulcer, so there used to be the scratching or the itching sensation. So by which the animal used to scratch so on any hard object in order to get relief. So this rupture may predispose and prolapse of iris sometimes used to be projected through this wound. And sometimes the keratosynthesis may be repeated. Sometimes whenever it is being projected out or the Descemet's membrane is being projected or protruded through this wound or the ulcerative wound, and it remains very away from the normal corneal level, so it has to be punctured. So that is called the keratosynthesis. And sometimes whenever it is being repeatedly done or concurrently is being done, it is being observed. So in that case, so regular or the repeated keratosynthesis can be done. Staphyloma, so protrusion of iris through this wound, the protrusion of iris may protrude out. So this is a very complicated condition. So sometimes we have to resect this iris at the site, and in some cases it is not, we are not able to resect. Sometimes we have to cut, so by the iris. Regarding the treatment of the corneal ulcers, different types of the therapeutic regimens are being given. So like the previous, the removal of the cause, different types of the NSAID are being given, the administration of the vitamin A, D, C, and so also the B complex, antibiotics ointment, and the administration of the antibiotic and the topical. In case of the animals, so we have to use the parenteral therapy. In case of this ulceration, So as we are in the doing the cauterization, say matchstick can be dipped in the 1% carbolic acid, so that can be applied to the site for cauterization. And the keratosynthesis may be performed in staphyloma, snipping of the iris that I was telling, so that can be done also. And in most of the cases in veterinary practice, we are doing the third iron covering over this cornea. And so also in some, whenever the animals are not very cooperative, so in that case we are doing the tarsography. Regarding the corneal opacity, the opacity of the cornea is one of the symptoms of the chronic keratitis. In milder form, there is only the cloudiness. The chronic cases invasion of corneal tissue by the fibrous tissue, so it is being replaced. And so also the opacity becomes, in that case, opacity becomes very permanent and it is very difficult to get rid of from the problem. So this is the example of this chronic keratitis, ulcerative keratitis. The etiological factors, edema, damage of the epithelium, the iatrogenic damage caused during the intraocular surgery. Sometimes during the intraocular surgery, we used to do the damage, and so also the severe inflammation, intraocular neoplasia, and the vascularization. So while I am operating the vascularization, so which is the condition of the panels, so sometimes we used to do the injury caused by the surgeons. The pigmentations, foreign body, xerosis, that is the dryness of the desiccation of the cornea. Neoplastic infiltration, dermoid cyst, whenever the dermoid cyst is used to be migrated from the conjunctiva to the cornea and it is being infiltrated to different layers of the cornea, sometimes it becomes very difficult to remove the dermoids. By scraping, we have to do the removal of the dermoid cyst. Regarding the classification of the degree of the opacity, that is called the nebula, macula and the leucoma, 1st degree, 2nd degree and the 3rd degree. So these are some of the pictures. That is the nebula, this is the macula, mild and more severe than that of the initial, the nebula, and so also the leucoma case. So these are the different figures, different pictures showing the types of this keratitis, chronic. The dermoid cyst, so that is the predisposition of tissue over the conjunctiva, and so also it used to migrate over the cornea with tuft hairs. It is a congenital condition. So whenever it is used to be infiltrated to the different layers of the cornea, it becomes very difficult and very sophisticated surgery is required under microscope. Under microscope means optical microscope or the ophthalmic microscope, and so also with the magnifying loop also it is required. Sometimes it is required. Corneal injury with the iris prolapse, the iris that we have already discussed. The temporary tarsography is being done, corneal ulceration. Sometimes in case of the brachycephalic bleed and in the bleed, particularly the POG and the bull mastitis, the eye is being projected out, the remains over the and the above the layer of this eyelids. So in that case, it is being very predisposed to the injury or the trauma. So this is a case of thorn leaking, so to the center of the cornea, and it has been removed. So in our unit, surgical treatment of corneal lesions. This is the corneal injury with the pedicle grafting. This is the keratoplasty. So this practice I have observed at LB Prasad Eye Institute during my 1 month training, and so at the ophthalmic training at the University of Queensland, Gatton campus, Australia. but we have not started this corneal transplantation in our unit. This is the conjunctival flap cutting, conjunctival graft cutting after healing. The treatment of desmetocele by conjunctival pedicle grafting. Then regarding the treatment of this, the anti-inflammatory eye drops, both steroid and non-steroid anti-inflammatory, and so also the steroid injections and the placental extract of the milk injections can be applied. Full thickness corneal laceration, so in which we know that whenever we are doing the surgery of the skin or the muscles, we are going to the full thickness, but whenever we are going to the internal organs, so we are staying with the 1 or 2 layers, because I am the upper 2 layers. So likewise, whenever we are doing the surgery of the cornea, whenever there is full thickness of the corneal lacerations, so we have to go with only the superficial layer and the Bowman's capsule and stroma, because the stroma is the 60% of the thickness of the cornea. So we have to remain within the stroma and we have to do the suturing. If we go beyond the basement membrane or the endothelial layer, so it becomes a very it gives very bad result regarding the this transparency of the cornea. So one should be very careful regarding whenever he or she is going for the full thickness corneal lacerations. And in animals mostly, so after doing this corneal laceration, full thickness corneal lacerations, we are doing this third eyelid flap covering, and so also so tarsorrhapy may or may not be done, but Elizabethan polar application is a must. That is very much essential. So while doing any type of the corneal affections in animals. So regarding the treatment, topical mediatics or the cycloplegic, suturing of the corneal injury, the topical or the systemic antibiotics, oral anti-inflammatory antibiotics can be adopted, and also the Elizabethan polar. Desmetocele, so we have already described. Surgical procedure, so lies with the grafting procedures, synthetic and the autogenous, provided tectonic support to the cornea, and also the metals used, corneal conjunctival transposition, and also the corneal pedicle grafting. So that gives the good result regarding the management. So the appropriate antibiotic therapy, appropriate antibiotics, different types of the antibiotics are being available in the market. But by doing the swab test and so also by doing the culture and sensitivity test of the superficial layer or the corneal swab, so we can make appropriate and pinpoint use of the antibiotics. So one important thing is lies with this corneal affection. So concurrently there occurs or there used to be the uveitis. So in order to avoid the uveitis, we have to take the proper and ethical care of the corneal management. So one such that is called the melting ulcer of the cornea. So in which the typically localized gelatinous cornea, so that is being extremely progressive, so can rupture within a day or so, and mainly caused by the Pseudomonas aeruginosa and so also the hemolytic streptococcus species. This is the typical picture of the melting corneal ulcer. So these are all the pictures except the corneal grafting. So these are our pictures. Regarding the treatment, anti-collagenollytic agents so are being used, topical orthoserum. Taking the serum from the same animal, so can be applied. So it gives the good result as like that of the placental extract and so also the milk injections or the milk application, sterilized milk application. So in this case, the EDA eye drops, the oral doxycycline and also the topical antibiotic drops can be used for corneal grafting. So can be done and it is required to do. So this is regarding the treatment of the corneal ulcer, a videograph. So I request to go for the videography of this. Please. Videography is only the 30 seconds videography. 30 seconds videography. Please. So how by using the corneal board, so we can go for the treatment of the corneal ulceration. So by using the videography, I have tested before formatting. So this is a videography showing the how you can use the corneal board regarding the treatment of the corneal ulceration. So this is also. This is also another corneal board. So it is made with the diamond. So that can be used for the treatment of the corneal ulceration. So this is videography is not showing, but I have tested. So it was. So regarding another technique, another important advanced technique, that is called the hydrodissection to create the conjunctival flap. The 0.9% that is the normal sodium hydrochloride or saline solution that can be injected.
Dr. Das, sorry to interrupt you. How much more time required?
3-4 times. 3-4 minutes. So by using and injecting subconjunctivally, so it gives a good the appropriate stage to create the conjunctival gravity. That is the new technique, advanced technique, hydrodissection. And treatment of a deep corneal ulcer by using the porcine small intestine mucous membrane, small intestine submucosa. So in this, we can avoid the operation. The surgical intervention can be avoided. So by taking a piece of subconjunctiva from the submucosa from the small intestine of the porcine, so that can be applied over the corneal this ulceration. So after that, third eyelid flap can be used. So after that, tarsorrhaphy may or may not be done, but application of Elizabethan collar is very required. So this is also a new technique without intervening with the surgical procedure. So we can treat the corneal ulcer. Thank you for your patience here. Thank you. Any question?
Dr. J. Krishna Das has given again the comprehensive information about the anatomy of the cornea and also various etiologies affecting the cornea and various different modalities to handle the corneal injuries, which are very common in day-to-day common animal practice. Thank you, Dr. J. Krishna Das.
Query regarding injection of milk.
Injection of
milk for treatment of keratitis. Is it okay if we use cow's milk or we need species-specific milk?
not specific. The cow milk also can be used, and also the market available the milk and the sterilized, homogenized, pasteurized milk can be used also.
Okay. Same is true for placental extract.
Sir?
For placental extract, same is true. We can use.
Placental extracts can be used subconjunctivally and so also topically, along with or without the milk injection. Milk injection can be given separately. Milk application or topical application can be done separately.
Regarding placental extract, can we use placental extract from the cow or from the same species? Is it
Now, placental extract injections are available in the market.
okay? Inject available.
That is available in the market.
for,
Preparatory for.
for milk we can use cows.
For milk, we can use the cow milk, which is available in the market, particularly the pasteurized homogenized milk. So that is when you use that gives the good result.
Okay, thanks.
Thank you.
Thank you.
Once again, request Balachandra sir to come over here and do the honors to be. And now,
Not sure.
I will give 5 minutes.
I once again request all the abstract presenters that they will submit their PPT over here so that it will be run smoothly. Please do it at fast because sir is going to present in this session. Please. We'll be waiting for 5 minutes only, and thereafter we'll be starting the PPT session. Understood, sir?
Please,